Symptoms and signs in psychiatry and classification. Mutism and illnesses in a person who appears awake and even alert is best described as stupor. Emotion is controlled by frontal lobe. A 25-year-old woman complains of intense depressed mood for 6 months with inability to enjoy previously pleasurable activities. This symptom is known as anhedonia. Alexithymia is inability to recognize and describe feelings. A person who laughs 1 minute and cries the next without any clear stimulus is said to have labile affect. Ambivalence is most commonly seen in schizophrenia. Ambivalence is most commonly associated with schizophrenia. Hallucination is disorder of perception. Hallucination and illusion are disturbances of perception, which is not a perceptual disorder. Delusion is not a perceptual disorder. Hallucination, illusion are perceptual disorder. Altered perception of real object is known as illusion. False sense of perception without any external object or stimulus is known as hallucination. Hallucination are perception occurring without external stimulation. A patient sees rope and fears like a snake. It is called illusion. A 8-year-old child after tonsillectomy sees a bear in her room. She screams in fright. A nurse who rushes in switches on the light finds a rug wrapped on an armchair. She pacifies the child. What the child experienced was a illusion, which is not true about hallucination. That it occurs in inner subjective space is incorrect. What is true is it is as vivid as normal stimulus and it is independent of will of observer. It occurs in absence of perceptual stimuli. All of the following feature of hallucination except it depends on willpower of observer and is under voluntary control is incorrect. Hallucination occurs in inner subjective space. It is vivid as sensory perception. It occurs in absence of perpetual stimulus. All of the following are features of hallucination except sensory organs are not involved is incorrect. They are involved. It is independent of the will of observer. It is as vivid as that in a true sense perception. It occurs in the absence of a perceptual stimulus. Visual hallucinations are seen in hebephrenic schizophrenia, residual schizophrenia, simple schizophrenia, delirium, and temporal lobe epilepsy. Formed visual hallucination are seen in lesion of temporal lobe. What is hypopompic phenomenon? Hypnopompic phenomenon. If experienced while awakening. Hallucination which occurs at the start of sleep is hypnagogic hallucination. Reflex hallucination is a morbid variety of synesthesia. A patient gets tingling when his bed light is flashed suddenly. Which type of hallucination is this? Reflex hallucination. Hallucination are seen in all except anxiety. So hallucination are seen in schizophrenia, seizure due to intracerebral space occupying lesion, and LSD. Cognition is thought. Cognitive disorders are delirium and dementia. All are format thought disorders except delusion and all OCN, that is obsessive compulsive neurosis. Which are the format thought disorders? Schizophrenia and loosening of association. So loosening of association is an example of formal thought disorder. Which of the following is not a disorder of form of thought? Thought block is not a disorder of form of thought. Which are the disorders of form of thought? Derailment, tangentiality, loosening of association. Delusion is a disorder of thought. Persistent belief in something which is not a fact is known as delusion. Nihilistic ideas are seen in Cotard syndrome and depression. A man hits his neighbor. Next day he feels that police is behind him and his brain is being controlled by radio waves by his neighbor. The probable diagnosis is delusion of persecution. A 25-year-old university student had a fight with the neighboring boy. On the next day while out, he started feeling that two men in police uniform were observing these movements. When he reached home in the evening, he was frightened. He expressed that police was after him and would arrest him. His symptoms represent delusion of persecution. Delusion is not present in compulsive disorder. Delusion is present in delirium, mania, and depression. Delusions are seen in all of the following except obsessive compulsive disorder. They can be seen in depression, mania, or schizophrenia. Delusion is not seen in anxiety. It is seen in depression, schizophrenia, and mania. Following are correctly matched pair except OCD infidelity is incorrect. What is true is schizophrenia, auditory hallucination; alcoholism, auditory hallucination; depression, guilt feeling. Delusion of persecution occurs in schizophrenia, paranoid psychosis, and manic episode. Delusion of grandiosity is seen in schizoaffective mania and paranoid schizophrenia. Erotomania is seen in bipolar mania. Perseveration is persistent and inappropriate repetition of the same thoughts. Thoughts in mind with rhyming rather than with meaning of thought is clang association. Loss of capability of doing goal directed things to express ideas, making irrelevant comments but ultimately succeeding in going back to original point is known as circumstantiality. Repetition of movements, acts, words, and phrases beyond point of relevance is known as preservation. Confabulation is a defect of memory. True about confabulation, it is a memory disorder. Confabulation is typically seen in alcoholism. Confabulation is filling up to gaps by fabrication to cover lapses in memory. Unfamiliarity of familiar thing is seen in Jamaia's Wu. Catatonic features are seen in schizophrenia. They are also seen in severe depression and conversion disorder. The DSM 4 classification of psychiatric disorder are proposed by American Psychiatry Association classifies and helps in diagnosing patient on multiple axes. On these the axis 5 represents the degree of global assessment of function. Consultation liaison CL psychiatry involves diagnosing psychiatric illness in medically ill. Rorschach ink blot test is projective. Rorschach test measures personality. Signs of organic brain damage are evident on Bender Gestalt test. The Halsted Raten battery involves all except, so it does not include constructional praxis. It includes finger oscillation, rhythm, and tactile performance. Which of the following is not a cognitive error dysfunction? Thought block is not a cognitive error dysfunction. Catastrophic thinking, arbitrary inference, overgeneralization, these are cognitive error dysfunction. Healthy thinking includes all except constancy. So, healthy thinking includes continuity, organization, and clarity. Organic mental disorders, all are seen in organic psychosis except normal common knowledge. So, what is seen in organic psychosis? Disorientation in place, time, and person, clouding of consciousness, hallucination, and intellectual impairment. Disturbed orientation is seen in organic mental disorder. Which of the following behavioral problems would suggest an organic brain lesion? Visual hallucinations. The following is suggestive of an organic cause of the behavioral symptom: prominent visual hallucination. Features of delirium are deficit of attention, autonomic instability, altered sleep wake pattern, and hallucination. What is true about delirium? Uh, True about delirium is disturbed sleep and hallucination. What is not true is preserved attention. All are features of delirium except loss of memory. Features of delirium are confusion, disorientation, and hyperactivity. A patient semi-conscious with altered sensorium with visual hallucination and fragmented delusion is suffering from delirium. A patient with pneumonia for 5 days is admitted to the hospital in altered sensorium. He suddenly ceases to recognize the doctor and staff. He thinks that he is in jail and complains of scorpion attacking him. His probable diagnosis is acute delirium. Global cerebral dysfunction, characterized by alteration in cognitive function and consciousness, is known as delirium. An alcoholic is brought to the emergency OPD with the complaint of irrelevant talking. He had stopped using alcohol 3 days back. On examination, he is found to be disoriented to time, place, and person. He also has visual illusion and hallucinations. There is no history of head injury. Most likely, the diagnosis is delirium tremens. Delirium tremens is characterized by confusion associated with autonomic hyperactivity and tremors. All are true about delirium tremens except severe depression. So, what is true about delirium is hallucination, extreme anxiety, and delusion. Slow waves in EEG activity is seen in delirium. Which of the following is not used in delirium? Lithium is not used in delirium. Not a feature of dementia is loss of sensorium. So, what are the features of dementia? Wearing of dirty clothes, forgetfulness, loss of neurons in brain are the features of dementia. Catastrophic reaction is a feature of dementia. Characteristic feature of subcortical dementia is none, and if none is not given, then memory loss. All are causes of subcortical dementia except Alzheimer's disease. So, what are the causes of subcortical dementia? Parkinson's disease, supranuclear palsy, and HIV associated dementia. Which one of the following is a subcortical dementia? Huntington's chorea is a subcortical dementia. Which are not a subcortical dementia? Alzheimer's disease, normal pressure hydrocephalus, and vitamin B12 deficiency. All are examples of cortical dementia except multiple sclerosis. So, which are cortical dementia? Alzheimer's disease, Creutzfeldt-Jakob disease, and Pick's disease. One of the following is a reversible cause of dementia. Toxic dementia is a reversible cause. Reversible cause of dementia is post-encephalitis and hydrocephalus. Multi-infarct and senile dementia are not reversible. Reversible cause of dementia is post-encephalitis. Reversible cause of dementia is hypothyroidism and vitamin B12 deficiency. Alzheimer deficiency and vitamin A deficiency are not reversible. Treatable causes of dementia are hypothyroidism, subdural hemorrhage, and hydrocephalus. Dementia is seen in all except schizophrenia. So, dementia is seen in head injury, Huntington's chorea, and frontal lobe tumor. Dementia is seen in all except schizophrenia. Dementia is seen in Alzheimer's disease, Huntington's chorea, and Pick's disease. Most common cause of dementia in adult is Alzheimer's disease. Pseudodementia is seen in depression. A 65-year-old male is brought to the outpatient clinic with 1 year illness characterized by marked forgetfulness, visual hallucination, suspiciousness, personality decline, poor self-care, and progressive deterioration in his condition. His mini mental status examination score is 10. His most likely diagnosis is dementia. Vascular dementia is characterized by disorientation, memory deficit, emotional liability, and visual hallucination. A 70-year-old man presents with a history of prosopagnosia, loss of memory, third person hallucination since 1 month. On examination, deep tendon reflexes are increased. Mini mental examination score is 20 out of 30. What is the most likely diagnosis? Alzheimer's disease. Protein involved in Alzheimer's disease is apoE gene, presenilin 2, and amyloid portion. Biochemical etiology of Alzheimer's disease refers to acetylcholine. Following are predispositions to Alzheimer's disease except smoking. So, which are the factors predisposing to Alzheimer's disease? Down syndrome, head trauma, and low educational group. All of the following are featuring Alzheimer's disease except cerebellar atrophy. So, which are the features of Alzheimer's disease? It is common in 5th and 6th decade, atrophied gyri and widened sulci, and it is progressive dementia L. Neurofibrillary tangles with senile plaques are seen in Alzheimer's disease. Dementia of Alzheimer's type is not associated with cerebral infarcts. It is associated with depressive symptoms, delusions, apraxia, and aphasia.